In this video, we are going to continue or complete the rest of the sympathomimetics. In the past video, we illustrated the direct-acting sympathomimetics, drugs that work on receptors themselves. However, today, or in this video, we will discuss drugs that are still sympathomimetics, but are either indirect, acting indirectly, or mixed. And mixed means they act directly plus indirectly. Okay? Let's start at first with the indirect acting sympathomimetics. We have an important drug called amphetamine. This amphetamine was used to be illustrated in about 3 or 4 pages. However, due to lack of usage recently, we began to discuss it in brief. What is the story behind this amphetamine? This amphetamine, at first, if you are trying to classify it, then it's classified as an indirect acting sympathomimetic. This drug is synthetic. It's not natural. It's not a cat. It's not a catecholamine. So it's a synthetic non-catecholamine. Then, can it cross the blood-brain barrier or not? Can it reach the CNS? Yes, it can be absorbed orally and reach the CNS. Now, this amphetamine, what is its story? And how does it act in your body? What is its character? This amphetamine goes to the nerve endings in your body and to the central nervous system. It performs a very important process. It goes to the noradrenaline present in the nerve endings or any chromaffin tissue and promotes its release. Releasing it. You have here alpha and beta. The drug doesn't go to the alpha nor the beta, it's unconcerned. The drug goes to the nerve ending itself or to the brain, to the neuron cell releasing from it norepinephrine. Not only this, but norepinephrine also undergoes a process of uptake. Do you remember when I told you that the uptake occurs to about 80%? It blocks this uptake. The transporter responsible for this uptake is inhibited by it. What is the result of this? The result is that norepinephrine accumulates in the synaptic space, in the connection points. If this is a neuron, nerve cell, and this is another nerve cell, and a third, norepinephrine accumulates among them in the neuronal tissue. It doesn't do this with the norepinephrine only, but also with the noradrenaline, the dopamine, and also with the serotonin. So not only with the norepinephrine. These 3 amines get out and are increased in the synaptic spaces, start to act on their receptors, and when they try to get back, it tells them sorry, there is no going back. The result is, with time, these transmitters are kept in your nervous tissue, either in the brain or in the other tissue and so on. When these transmitters accumulate and their level increases, they begin to swing at the alpha and the beta, as you already know. What's next? You start to experience changes all over your body. Number 1, you undergo CNS stimulation. Because of all of these transmitters, your body can never sleep. They won't leave you alone. You would be alert. They induce a state of diffuse stimulation. If this is the CNS, the drug starting from the cortex, reticular formation, hypothalamus, spinal cord, peripheral nerves, all of these get stimulated from head to toe, okay? 2. You experience anorexia. You don't want to eat. Anorexia means loss of appetite, alert, focused, not feeling sleepy, and even don't want to eat. This feels good. Thus, some people would take advantage of this. They would say, let's take this drug so we don't eat much. Some people complain of eating all day long. Good news, this drug may help me. Number 3. If the drug is slightly increased and increases all these transmitters, which are noradrenaline, dopamine, serotonin, the 3 of them are increased. When these transmitters are increased in your body, not only you experience CNS stimulation, but also something called euphoria. Euphoria begins with the letter E, yet it's pronounced with U directly. Euphoria means a form of elation. Your mood is up. You are alert, your mood is up, you're happy, joyful. 4. If the drug is increased a little bit and the transmitters are increased a little bit, you start to experience hallucinations, visual and auditory hallucinations of any kind. You start to imagine unreal things, laughing mindlessly, and it also causes euphoria. So you feel happy. Hallucinations sometimes turn into delusions. Delusions mean misapprehensions, and sometimes it turns into psychosis. Psychosis means losing some contact with reality. You believe in unreal things like ghosts. Yes, some may tell you he sees ghosts. You would say, are you on amphetamine? As amphetamine makes you see non-existent things like this. He doesn't see them, he thinks he sees them. This is called psychosis. Psychosis is when you lose the ability to recognize what is real and what is not real. Again, let's sum up. Amphetamine is a synthetic drug. They started to manufacture it since 120 years ago. When they started to use it, they found out it increases the noradrenaline, not only noradrenaline, but also dopamine and serotonin, increases their release and inhibits their uptake. So it results in the accumulation of these transmitters inside the synaptic spaces and the neuronal tissue. It keeps these transmitters, and when these transmitters accumulate, you start experiencing a CNS stimulation, diffuse stimulation. You become alert, you don't want to sleep, you stay for 2 or 3 days awake, not wanting to sleep. You lose your appetite for food, so you don't want to eat. You are not just alert, but also in a good mood. And if the drug is increased, you start hallucinating and experience delusions or miscomprehensions. And also psychosis. You see non-existent things and you are happy and so on. Surely, you don't need me to draw your attention. It's very obvious that people got used to this drug. Why did they get used to it? Because it has some fantastic effects. It makes you alert. All of you complain of being sleepy all day and ask for something to wake you up. Here it is, my friend. This drug shall wake you up. Not only wake you up, it makes you alert. And your physical performance excels. This means fatigue goes away. If you are fatigued and tired, fatigue goes away. So you are alert without sleeping for 2 days and you don't feel tired. You have no desire for sleep. Your body feels good. Not only this, you don't want to eat. You are euphoric, your mood is up. And if the dose gets higher, you would see the stars at noon and people on Mars and so on. This drug, as it was being widely used in the 70s and 60s, started to do something that we don't like. The word that we don't like, which is called addiction. Addiction can sometimes be replaced by the term physical dependence. Physical dependence means relying on it. People start to rely on it. People started saying, if I don't take amphetamine, I become drowsy all day. I must take amphetamine to be able to work, to stand on my feet and work. Because it takes away the fatigue, makes me alert, and so on. Then we fear this drug as people started to depend on it, so some governments started to prohibit it, and amphetamine is no longer present in many countries including Egypt. You can no longer get this drug from pharmacies. Don't go after this video ends to them asking for amphetamine. The pharmacist would look at you up and down. Because amphetamine is being dealt with like illegal drugs. It's not an illegal drug, but we deal with it as if it were one. It's banned. Banned means prohibited. It's banned, no longer present. What's present is its derivatives. And I'll tell you what they do and what their uses are. So this drug was originally present in the past in the 60s and 70s and is still present in some countries which allow it. It's their issue, not ours. Anyway, this drug is used as a CNS stimulant. And if you are alert and focused, also in obesity. Obesity or overweight, since it inhibits the appetite. It was commonly used for these two purposes, as a CNS stimulant and for obesity. Now it's no longer present. What's present is its two derivatives, which are present in your book, and in which I may ask you, what are the two derivatives of amphetamine that are present in your book and currently available in the markets? A derivative called methylphenidate. Methylphenidate. Phenidate. This is a derivative of amphetamine. The other derivative is called Moda. Moda from mode, Modafinil. Modafinil. These are the two derivatives that are available and can be bought and used. What is this methylphenidate? We have a very peculiar state. It's present in your book, illustrated on the right side in the dark box. A state that occurs in some children called ADHD. I'll explain it to you and show you how could amphetamine or its derivatives treat such a condition. ADHD is an abbreviation of a very common disease, very frequent in the West. They are very interested in it. This disease is called attention deficit hyperactivity disorder. If you search it on Google, you will find so many papers and articles about it. ADHD is a disease or a condition, a neuropsychiatric disorder. It's not exactly a disease. However, it's more or less some sort of a condition that affects children, usually occurring among the age group from 6 to 12 years. Usually at this age, some of the children, a ratio of children, it's rather a small ratio, not a large one. You can see that some children at this age, which is the age of school entry, the child from this group is not to be hyperactive. The teacher complains to the parents that their child is abnormal. During classes, the child keeps making gestures with his hands, plays with anything, pokes his classmates, and doesn't focus on what teachers say. When you ask him to keep focused, he nods at you and continues playing. He forgets his bag in the school, and one time, he goes home without his shirt. One time, he goes home with one pair of shoes. And when you ask him where the other pair, he tells you that they were too. Yes, the child is not attentive, hyperactive, and is messing with everything. He keeps jumping and occupying himself with tons of objects and is not attentive to anything. That's why this disorder is called attention deficit, which means a loss of concentration. Attention deficit means a lack of concentration and focus, while hyperactivity means the child is hyperactive, impulsive, and not attentive to any signs or anything. If you turn a blind eye to this disorder, these children don't continue their education. Why don't they continue their education? Because if we don't take care of them, which usually happens in developing countries, this child continues this behavior, and the teachers complain to the father, asking him to find a solution. They complain of the continuous impulsivity of this child, who keeps playing, doesn't care for their lessons nor obeys their advice, and won't be any good in exams. If the father and mother are not well educated and unaware of their child's condition, they might lose control, hit him, and threaten him from further repeating this behavior. They don't know that this is a biological disorder. It's not the fault of their child. There is a disorder in his brain, and there is a problem in his brain that compels him to be like this. And he can't help it. He can't stop jumping and playing. He can't be attentive. If this child is in America or other aware countries, the teachers there who deal with children in this age group from 6 to 12 are well trained on this disorder. Its symptoms are well memorized by them, and they are asked to keep an eye out for any child with such a behavior. They shouldn't stress him, but refer him to a specialist. Then the father and the mother get educated on this condition and the drugs that their child needs to improve. The child's condition is temporary and will go away after 12 years. With proper medication and care during this time, the child can continue their education and become normal. However, hitting and abusing the child will only harm their future. Why did I explain this story to you? Because they noticed long time ago that amphetamine, which is no longer present, makes these children better by increasing their attention span. Attention span means the amount of time spent concentrating on a task. He could be attentive for minutes, but busy for the rest of time. When he takes amphetamine, he stays focused and the activity and the hyperactivity goes away. They kept these children on amphetamine for a period of time. However, when they found amphetamine, as I told you, to be addictive, they made a better derivative out of it, Methylphenidate. Thus, this methylphenidate has become the amphetamine derivative specialized in, or the official sponsor all over the world for treating the children with ADHD, Attention Deficit Hyperactivity Disorder. And here is a common MCQ question because this drug is very well known for this worldwide. Methylphenidate is a scientific name, there are a lot of trade names, okay? Now we finished this condition, let's see the next condition or the next drug. The other derivative of amphetamine, which is called Modafinil. This Modafinil is a derivative of amphetamine. It works in a similar way. It also accumulates the norepinephrine, the dopamine and the serotonin, the same mechanism. However, it has become well known for treating a condition called narcolepsy. Narcolepsy. Narco means nighty. Lepsy means sleep. What is the problem? We all sleep at night. No, this disease is not about sleeping at night. This disease is also a neuropsychiatric, a neurological disease, and rare. However, People are affected by this disease become sleepy all day and experience sudden attacks of falling asleep. It's not like a nap in the afternoon, no. He is standing talking to you at one moment, the next one he's asleep. Then you wake him up, he wakes up and talks to you for a moment. Then he goes back to sleep. These attacks are sudden. He suddenly loses his consciousness. Then he wakes up and continues the conversation. Of course, this could lead to a disaster if this narcolepsy affects a driver. If a driver or a man who has a car also has narcolepsy, this can't be good. This means he will fall asleep while he's driving. This could lead to a catastrophe. What is the cause of this disease? No one knows. What happens exactly to the brain to make someone experience sudden attacks of sleep during the daytime? No one knows. Okay, when these attacks occur once or twice, these attacks could be as many as 20 or 30 times. You could see a man who has narcolepsy while he is returning home from the market holding a bag or two of groceries. Suddenly, the attack occurs. He leaves his bags and becomes asleep while he is standing. 2 or 3 or 5 minutes after, he gets back his activity, holds his bags again and continues. We were surprised to see that these patients also improve when they take amphetamines. And as I told you, since amphetamine is addictive, it leads to physical dependence and people get used to it. Then they decided to make a derivative of amphetamine and called it Modafinil. And Modafinil has become the official sponsor for treating the patients with narcolepsy. Okay? Now amphetamine and its derivative collectively like this. Now I need you to use your mind. If I ask you about their adverse effects, if they exceeded their normal levels and caused problems in the body, what would you expect to find? The first one, didn't I just tell you that they are classified as stimulants? They are classified as CNS stimulants. So if they exceeded their normal levels and caused some adverse effects, you should expect these effects to be related to the CNS stimulation. What does this mean? It means that the patient suffers from insomnia. Insomnia means the inability to sleep. Tachycardia, his pulse speeds up. Nervousness, he becomes nervous. Headache, he complains of irritability and ill temper. He tells you he hasn't slept for 4 or 5 days and he can't bear this. So go to sleep then. He tells you he has no desire to sleep. He may also suffer from a seizure. Seizure means epilepsy. Attacks of epilepsy. He may experience seizure and fall to the ground. All of this is due to increased levels of norepinephrine and other transmitters in the brain while also inhibiting the reuptake. So all of the side effects are due to the CNS stimulation. This drug, amphetamine, and other similar drugs, its cousins, are extremely dangerous to the epileptic patients. Epilepsy is a condition in which seizures are produced due to CNS stimulation, which results in the attacks of epilepsy. Also, I told you that it induces physical dependence. Physical dependence means that patients get used to it and become unable to stop taking it. Something like addiction, as we mentioned earlier. So, here are the side effects that you should expect. And these side effects don't appear except with the high dose. And these side effects may be the reason why we no longer use amphetamine and started to look for replacements, synthetic derivatives that are less potent and much more bearable. So the side effects are less frequent with these two, with Methylphenidate and with Modafinil. Okay, this is the amphetamine. The other medication, it's not a medication exactly. It's rather a recreational drug. People use it like stuff. The one that you hear lots about it everywhere, which is called cocaine. It's called cocaine, but if you were high, you would probably pronounce it like cocaine. No problem, cocaine or cocaine, what is its story? This is a plant alkaloid. Alkaloid means a natural substance with alkaline reaction, a natural substance found in plants. A plant called coca. This plant, called coca, which gives us cocaine, is widely found, or more commonly present in Southern America like Colombia and these countries which are interested in drug dealing. This drug is produced from the coca plant, and of course, it's not a catecholamine, so it might be chewed or smelled or something like this. What does it do in your body? This drug, in brief, I told you, when norepinephrine and transmitters are released, they come back. This drug inhibits their reuptake. The result is the transmitters accumulate in the synaptic spaces and produce the same effect, typical of those produced by amphetamine. So, what's the reason behind the widespread use of cocaine as a recreational drug or stuff? It's because it causes CNS stimulation, eliminates fatigue and improves physical performance, making you like a lion, so you can stay awake for 3 or 4 days, focused, not tired, not want to sleep. Thus, people started to get used to it, exactly like amphetamines, and that's why governments fight it. Because people got used to it. There are some people who can't function without it. They became cocaine addicts and can't live without it. If he cuts it, he sleeps all day and stops work and his head tortures him. So, cocaine is not a medication, naturally. However, you have to study it because it would be a shame if someone asks you about cocaine while you're studying this large book of pharmacology and you don't know even 2 lines about it. However, it's not a medication. I don't have a drug in the market called cocaine. It was present, maybe, is still in some areas, in the form of eye drops, no more. But why eye drops? Does cocaine have any qualities other than what I've just told you? Does it have any effect other than preventing the uptake of the transmitters resulting in stimulation? It has another quality, a little distinct from this, as it could be considered a local anesthetic. A local anesthetic means it affects a restricted area of your body. The area that comes in contact with cocaine becomes numb or less sensitive. So it was sometimes used as an eye drop in case you want to perform a minor procedure in the eye without being continuously interrupted by the patient's blinking. They apply this cocaine to induce local anesthesia. A local anesthetic, this is its only use. It's only used in medicine, in the form of eye drops. Only as eye drops. Don't ever say anything else. Don't ever be fooled by an examiner who may ask you if you have heard about a good medication called cocaine. So you tell him, yes, I know it. He'd continue. They say it eliminates physical fatigue and makes you study better. Could you tell me its name in the market? Tell him it's not present. There is nothing called cocaine to begin with. It's just an eye drops. Other than this, it's not present. Okay, if cocaine causes toxicity, what do you think could be its manifestation in the body? Exactly like amphetamine, the patient may experience symptoms of nervousness, convulsions or seizures, headache, arrhythmia, tremors, and loss of control. Okay, how can we control it? With a sedative. If a patient becomes intoxicated by an overdose of cocaine, such as a drug addict receiving a large amount of cocaine, it can cause diffuse stimulation, exactly like amphetamine. Give him a sedative from a family called benzodiazepines. This is such a large family of sedatives that will be explained in detail in the CNS. We will explore them thoroughly. These are well-known sedatives that can be used in any situation, not only in cocaine. Any intoxicated patient by a drug causing CNS stimulation, don't even think about it if it was a question. Tell him the treatment is benzodiazepines. This is a sedative. It lowers the electricity, making everything calmer, so the patient can sleep. Okay. Now we have finished with the drugs that are called indirect acting sympathomimetics. Let's take a look at an old drug that's no longer used very often. It's classified in your textbook as mixed acting sympathomimetic. What does mixed acting mean? It means it acts with 2 mechanisms. It acts through the mechanism of stimulating alpha and beta, so it's direct. And it also acts through the other mechanism of releasing noradrenaline, so it's indirect. As if this drug acts with both mechanisms, direct and indirect. Thus it can be considered a mixed-acting sympathomimetic. What is it? Ephedrine. Ephedrine. This ephedrine was also explained in the old textbook in about 3 pages. But as its uses are becoming very minimal and no longer widely available, so we have summarized all relevant information in a single paragraph that's sufficient for students. There's no need to burden yourself with irrelevant information by studying old books and questions. We have removed the irrelevant information for you, so what you see is all what you need. Ephedrine is a plant alkaloid, meaning it's derived from a plant. Alkaloid refers to a substance with an alkaline reaction, so it's a natural. And it is a non-cat. You already know what non-cat means. Okay, what is the story of this drug? First of all, this drug is derived from a plant called ephedra. The plant's called ephedra plant. The ephedra plant was discovered by the Bedouin people who live in the desert. Bedouin people who live in the desert. This herb, when chewed, produces a noticeable increase in alertness and decrease in sleepiness. Shepherds who herd sheep in desert and wild areas also noticed that when sheep eat a certain herb, they don't sleep. This herb is ephedra. And the reason the sheep don't sleep and become active, running all day long, and can sleep at night is because the ephedra contains ephedrine, which acts in 2 ways. It stimulates the receptor in your body and releases norepinephrine, similar to amphetamines, which also causes CNS stimulation. So the drug does three things. It stimulates all alpha and beta receptors, resulting in similar effect to adrenaline. It releases norepinephrine from the nerve endings, and it causes CNS stimulation. This drug is non-selective, which means it acts on many parts and induces a wide range of effects. A non-selective drug is not popular, so we don't often use it with all of its side effects. We used to use this ephedrine before, as it stimulates all the receptors including beta-2. Thus, it was used in bronchial asthma to stimulate beta-2, inducing bronchodilation. But then they said, we now have a family of drugs that are specialized in beta-2 and doesn't cause such a wide range of effects, so why would we keep using ephedrine? Thus, it's no longer used. It was also used in other types of diseases such as nocturnal enuresis. In the past, children with nocturnal enuresis, also called nighttime incontinence, received ephedrine to prevent them from going into deep sleep, since it's a CNS stimulant. The drug causes CNS stimulation to keep the child from going into deep sleep. Accordingly, when he receives this drug, he becomes a light sleeper and may wake up in response to small disturbances so that he won't urinate over himself at night. We no longer use such drugs, we no longer use it for this purpose. Today, the use of ephedrine is very limited, and we no longer feel the need to burden you with unnecessary details while explaining it. There is a type of ephedrine that may still be available in pharmacies if you ask the pharmacist about ephedrine. He'll tell you what we have is something called pseudoephedrine. Pseudoephedrine is its isomer. Isomer means it has another chemical formula. You know isomers from chemistry? Do you remember dextro and levo? Isomer means one is levo and the other is dextro, for instance. So if we say ephedrine is dextro, then pseudoephedrine is its isomer, is its levo. Anyway, it can be considered its derivative or its different form and called pseudoephedrine, which is used as an eye drops only. An eyedropper and a nasal dropper. Hoping to stimulate alpha-1, causing vasoconstriction in the eye and also act as a nasal decongestant. And it's not even very commonly used, as I've just told you that there are now a family called nasal decongestants, which are specialized in the nose causing vasoconstriction. Pseudoephedrine can also be used as it stimulates the alpha, however, it's not commonly used, okay? If someone asks you in the exam, tell me son, why are we no longer use ephedrine? Tell him, number one doctor, it's because it's non-selective, a drug that's a sympathomimetic and mixed. It acts directly on the receptor and indirectly causing CNS stimulation. He may ask, is there another reason for not using this drug that's no longer preferred? It was one of the most known drugs and the most well-known ones that cause urine retention. Urine retention. Do you know why? Additionally, it causes this retention in patients with enlarged prostate. Elderly men above the age of 50 or 60 years who have enlarged prostate. Why? This drug is taken orally and stays in your body for about 8 hours. It stimulates both alpha and beta. Do you remember, my friend, what's the function of the alpha and beta in the wall of the urinary bladder? Their function is to induce relaxation. Do you remember, my friend, what does alpha-1 do in the sphincter? Contraction. Thus, it holds the urine. Okay? Now the man who is 60 years old with enlarged prostate and complains of urine retention. When he took ephedrine in the past, he was complaining of urine retention. Why? As the drug stimulates this alpha and beta, inducing relaxation and also goes to the sphincter, causing contraction. And he is already suffering enough as the enlarged prostate is already suffocating it. And this is one of the other reasons why we do hate ephedrine. When you say this to the examiner who is trying to catch you out with mistakes, he asks you why we hate ephedrine, so you tell him it is non-selective and also causes urine retention. Then you explain all of this to him. He responds saying that adrenaline also stimulates alpha and beta, and yet we didn't mention in the side effects that it causes urine retention. Be smart boy and reply to him instantly by saying, look doctor, it's because adrenaline stays in the body for just minutes. As a catecholamine, it doesn't last enough to cause urine retention, it's broken down before that. Urine retention requires about 8 hours in order to happen. The drug should stay in your body for at least 8, 9 or 10 hours, so it may occur with ephedrine. This makes sense as it's not destroyed by MAO nor COM to be a non-catecholamine. Until it's broken down and eliminated from your body, it requires about 8 or 9 hours, which is sufficient to cause retention in a patient with prostatic enlargement. However, adrenaline can never cause retention as it's not possible for it to last more than a few minutes in your body. And retention can never occur within minutes. Now we have explained ephedrine, and I even told you some notes that might not be in your book just in case, even if we don't delve into such details. The next video is going to be about alpha blockers and beta blockers.